Welcome everyone to the Hemophilia Council of California. This is our first webinar of the year. I'm Lynn Kinst, I'm the Executive Director of the Council, and tonight we are going to be talking about the state of healthcare in California, give everyone an introduction to kind of where things stand.
So finally, what are some of the other proposals that we're watching for you or working on in the Capitol in 2022? So first of all, we are going to be introducing a resolution in March as Bleeding Disorders Awareness Month, and that's going to be introduced by Senate Health Committee Chair, Dr. Richard Pan. He has carried this for us in the past, and as soon as we have a number attached to it, it will be a Senate concurrent resolution. We'll get that out to all of you via email, but we're very excited because this is a wonderful tool to educate new legislators and new staff about hemophilia and other related rare bleeding disorders. There's also a new step therapy law in California that was signed last year to help our patients, AB 347 Arambula. Dr. Arambula is the other, well, now we have three physicians in the Capitol, so we now have Dr. Weber, but before she was elected, we had just Dr. Pan and Dr. Arambula, and so we work with a lot of the physicians that have leadership positions in the Capitol. Dr. Pan chairs Senate Health, and Dr. Arambula chairs the Budget Subcommittee on Health in the Assembly. There's also AB 1400, ACA 11, which is the single payer proposal. So we're monitoring that. We don't have a formal position, but we're just watching that. It's a very costly proposal. And so whether it has any chance of passing is unknown at this time. It probably has an uphill battle. Any copay accumulator adjusters and copay caps, we're also going to be watching and monitoring, and we believe that this may get addressed at the federal level, but the state could weigh in as well. So we'll be monitoring any bills that get introduced regarding this. Telehealth should continue in California in 2022. It was funded fully in the budget last year, which is in operation now. And there was also a wonderful report that the Department of Healthcare Services released and published recently that shows that it's working in California and that the state supports both audio and video, like what we're doing now, to continue and to be paid for in California under telehealth. This budget cycle will be discussing ways in which we can fine tune it going forward, but we're hearing from a lot of the hemophilia treatment centers and others that both patients and caregivers really support this concept moving forward. So we'll continue to monitor that and to monitor all of the implementation with CalAIM, with Medi-Cal RX, with enhanced care management, and with health equity for our community. I'll turn it back over to Lynn.
Thanks, Terry. So we just want to remind everyone briefly, the state budget and these bill proposals are not final, but we're really just in January at the beginning stages of these things being negotiated and working their way through the legislative process, which is why our voices at this point in time are so important, that we begin to take positions and share with legislators and their staff why these issues are important to us. So we have just a bit of time left, so I'm going to go through a few more slides rather quickly. Do want to remind everyone, and we've done a lot of education around GHPP and CCS in the past, and we have a number of resources, including some past webinars that are fully devoted to these topics on our website. So if you are interested in knowing more about GHPP and CCS, I encourage you to go back and find those webinars. But as we've said, we do see them at this point, the governor's proposed budget fully funds these programs. They provide health coverage for bleeding disorders patients, GHPP for those 21 and over, and CCS for those up to age 21. And it's really critical that if you have a need to utilize these programs, that you learn more about how to enroll, and we're happy to help assist you in that process. Also, briefly, we know that mental health has been a big issue. Just, dealing with having a chronic medical condition is a stress. COVID has been a stress for many people. And so there's a lot of resources. There's a lot of links here, which I know you can't access in the slide deck right now, but on our website, we do have a list and links to a lot of different resources that are available in the state. And we will continue to monitor a number of new behavioral health measures that intend to make these services more available to everyone on Medi-Cal and also through GHPP and CCS. So really briefly, we did just want to highlight a few accomplishments and also some priorities for the coming year. And I think we've mentioned some of these things already. In the end of 2021, we did launch our Advocacy and Access Ambassadors program, and still have an opportunity if somebody's interested in joining that and learning more about how to be an advocate on the regional and state level. We'd love for you to reach out. Hosted our webinar series, policy summits, connections, and did a health equity research initiative that we're really excited about. And we're going to be talking more about that at our February policy summit. So if that's something that is of interest to you, I'd encourage you to reach out about how to get registered for the policy summit. And so plans for this year, we have our Advocacy and Public Policy webinar series. This is the first in our monthly webinars. As I mentioned, Advocacy and Access Ambassadors. Washington Days is going to be virtual again this year, and I would encourage you to register to participate in that. The deadline's coming up on February 5th. As well as our Future Leaders program for high school students and Legislative Day for the whole community. So please watch for more information. We're adjusting the schedule a little bit for those programs due to, unfortunately, needing to take them virtual again this year, but wanted to alert you that those dates should be coming out soon. And we have our first policy summit, as I mentioned, on February 17th. And we will continue to do all of this in collaboration with the local foundations around the region. And so on advocacy, as we've mentioned, we're advocating for full funding of Medi-Cal, CCS, and GHPP. We're introducing our Senate resolution for Bleeding Disorders Awareness Month. We're going to be working on copay accumulator adjusters, monitoring Medi-Cal RX, CalAIM, and the behavioral health initiatives, supporting HCC sustainability efforts, which really is about patients having access to HTCs, as hemophilia treatment centers are the sort of gold standard of comprehensive care for people with bleeding disorders, monitoring telehealth, and expanding efforts to understand the barriers that underinsured face. And then our educational priorities, again, just focusing on, increasing webinar participation, focusing on health equity, health disparity, and health literacy, and assisting patients with resources to be able to resolve access barriers. So we have several upcoming webinars planned, a couple of dates that we know for sure. February 16th, we're going to talk about why it's easier to kill a bill in the legislature than to pass one. Understanding health insurance will be in April, and healthcare access as it relates to CCS will be in May, but watch our website for all those dates and we will send those emails out to everyone so you can register. So I flew through that last part and we're just a tad over time. So thank you for hanging in there with us. We do want to thank our webinar series sponsors, Sanofi Genzyme and CSL Behring. And I know that there will be others added to that as the year progresses. Thank you all for coming. We'll have a great evening and we will see you soon. Good night.
Bye, everyone.